have several of our experts with us this afternoon, and I will note that we are at 10 different locations pulling this together. So we appreciate your patience as we mute and unmute our phones. Today with us, we have Paul Kader. Paul is our Vice President of Risk Management Services, Kelly Goodsell, Vice President of Claim Risk Management, Adam Brown, Senior Vice President of Manufacturing and Distribution Risk Specialist, Casey Cohn, our Senior Human Resources Consultant, Nate Bradley, Employee Benefits Consultant, Chuck Baracco, Vice President with One Group Retirement Advisors, and Todd Hoffman, our Senior Bank Liaison. We'll be discussing updates and also frequently asked questions in several different areas. We're going to go into the areas of risk management, claims and coverage, human resources, employee benefits, including 401k and other retirement vehicles, and small business relief for employers. We do have to include a disclaimer, of course. This is for informational and educational use only. Nothing in this discussion should be considered legal advice. Please consult with an appropriate attorney or advisor before addressing any situation raised in this discussion. And as you all know, the situation we are in continues to change. There's so much activity, and we all are very busy interpreting it all as it applies to our employer groups, our clients. Most recently, we have the passing of the CARES Act, which was signed into law just last week on March 27th. There was a lot in the act, including a small business loan program, which we'll talk about today, expansion of eligibility and additional payments for unemployment, which we'll also address today, Paycheck Protection Program, expansion of telehealth for Medicare recipients, and much more. And we know there's more to come in future phases. We know that phase 4 is currently under discussion. So for today, we're going to discuss what we do know to be in place. We've structured this discussion to cover key updates in areas that our clients have been asking about. We also requested that participants share any questions, and we appreciate those who sent questions. We'll certainly respond to those in this discussion. And due to the number of participants, we've muted all callers. So if you do have a question as we're going through our discussion, please reach out to your One Group contact. We will be posting content, and we have been posting content from our previous webinars to our website, www.onegroup.com. Right on the homepage, there's a whole, which we're showing right now for those of you who have logged in, there's a whole COVID-19 section on the main page that includes all of this information. And again, we'll be putting the webinar, posting it to the website as well. So with that, we will turn the conversation to risk management and Paul Kader. Paul has been on all of our webinars we've done, and if you've heard him before, he's certainly a very integral part of One Group's client response team, as well as he serves as our internal subject matter expert. Paul.
Thanks, Allison. Appreciate the comments. COVID-19, it continues to just unfold with changes and different laws and different requirements and different guidelines coming out every day. With the changes to the essential business definition, passing of the CARES Act, and changes and developments in how to respond and how to approach the coronavirus within the workplace, it is something that we have to stay on top of. What I want to provide you today is a very basic overview of information on how you can handle the exposure associated with the coronavirus in your workplace, assuming you're an essential business, and how you can respond to situations of potential exposure or actual positive testing within your workplace. Two key areas that we want to focus on as we go through are operational controls and response. And operational controls, what we're really talking about is that's the old safety and prevention aspect. We want to make sure that we try to reduce or eliminate, and probably more reduce, the number of COVID potentials and COVID actual in our workplace so that we can maintain a viable workforce and maintain our productivity for those essential products. In operational controls, we're going to look at making sure your workplaces are clean and hygienic. That's number one, and that's two pieces there. Number one, when you read the material on COVID-19, the first thing you have to do is clean. That's if you have sawdust all over your workbench, if you have metal chips, if you have whatever the case is all over your workbench, that has to be cleaned off before you start your sanitizing process. So please make sure that you clean and then sanitize. Provide materials to your workplace, to your employees throughout the workplace on a constant basis, and have a schedule of routine cleaning. If you had one before, then I'd add to it. Whether you double it, whether you add a couple clean downs extra through the course of the day. If you are in the food process business or in the healthcare business, you're under guidelines from the health department or the CDC or the FDA to make sure that you are following a certain schedule. If you're not in those areas, if you're non-healthcare and whatnot, then look at what you're doing and add to that. Our objective there is to eliminate the virus as much as possible from the workplace. The next thing is promote thorough hand washing by employees, contractors, customers, managers, anybody who happens into your facility. We'll talk about who comes into the facility in a minute. Put sanitizing hand rub dispensers throughout the facility or soap and water washing facilities throughout the facility, and make sure that people have access to them and they're using them, and make sure that they are filled and refilled regularly. Nothing worse than going to a sanitizing station and find out that it's empty. Next thing is communicate and educate your employees on a routine basis. This has to become part of our day-to-day conversation. And that's putting up posters, talking to people as you're going through to talk about the importance of hand washing and sanitization. Constantly talk about the need for hygiene, distance, and et cetera. New thing that I found as I was going through the materials was promoting respiratory hygiene in the workplace. And this isn't talking about use of respirators. This is talking about day-to-day, you're standing at your machine, you're sitting at your desk, promoting respiratory hygiene. And what that means is looking at it and ensure that people have face masks in case they feel that they're getting a cold or they have some symptoms or things like that, that they can put a face mask on. Well, yeah, I've only got a cold, it seems fine. Well, that's fine, but we don't want to spread that just in case, so put a face mask on, put a mask on. In a few weeks, you might even be able to get an N95, who knows? But make sure there's tissues available for everybody in case they need to blow their nose, so that you don't see the guy standing at the machine wiping his nose on his sleeve. Make sure that there's facilities out there that people can maintain a proper respiratory hygiene program, and make sure there's some place to dispose of those items when they're done with them, and that the disposal is taken care of in a hygienic manner. Think about who comes into your facility. You've got employees coming in, you may have contractors coming in, you may have other business people or customers coming in. When I say think about it, decide who it is you want in your facility at any given time. We've seen how aggressive this virus is and how quickly it can travel throughout geographies, throughout organizations, throughout buildings. So think about who it is you're inviting into your facility and consider what they might be bringing. Ask your employees to notify you if they're taking any trips. I had one situation of a company that an individual went down to New York to take care of a relative about a week and a half ago. Before things really got cooking real well, the Monday they got back, that's when the governor issued the advisory to quarantine people that have been down in New York for any period of time. So think about where people are going, where people are coming from, and ask your employees to let you know whether or not they're going on any kinds of trips. Identify who's coming into your facility from the standpoint of contractors and vendors, and establish and frequently review policies on who is coming in. Do you need to have that customer coming in, or can you deal over the phone? Most of us have sort of switched to a distance learning process, and we're talking to everybody by Skype and by WebEx and by phone, and business is being done that way now. But think about who you do have coming into your facility, and when you do have somebody coming in, if you have a contractor coming in, don't give them free access to your facility. Don't march them through the middle of the facility. If they need to work at the back of the building, bring them in through a back door and let them work there. There's no need to allow people free access, because as they come in, if they are contaminated in some way, they could spread the virus. Keep up with your OSHA programs. When we get into a situation of emergency like this, we tend to sort of forget about the things we've done in the past. Don't let those things slip, because you're still susceptible while you're running these operations to your slips and falls and your guarding incidents and things like that. Do not back off on those. Along those lines, and along the lines of OSHA, I want to make you aware that MACNY is actually doing a presentation on April 3rd at 1 p.m. And I think we're going to be posting the notice on our website because it's an important notice. The two of the safety specialists out of the OSHA office in Syracuse are going to be getting on and talking about what OSHA's stance is and any tips and practical advice that they can give relative to managing COVID in the workplace. So keep that in mind for April 3rd. So from all those standpoints, and again, it's just a 20,000-foot view of prevention, we want to do whatever we can do to eliminate or minimize the spread of the virus within our workplaces while we're working on those essential operations. The next thing, though, is response. What are we doing? This is where a lot of the questions that we've gotten have come in. What do we do if there's a suspected or an actual positive test of COVID in our workplace? First thing is this: you treat every suspected COVID-19 case as a positive case until you've received confirmation whether it is or isn't. You should send home all employees who worked closely, and there's no clear-cut definition of closely. It could be right next to it, could be within 6 feet. There's work closely with that employee to ensure that the infection doesn't spread. In addition, you have to look at people that are just showing the symptoms. If they're showing the symptoms, again, treat them just like they have the virus until you have confirmation that they don't. Now, in a lot of cases, you cannot get confirmation from an actual test because the medical facilities are only testing those with dire need. So you're going to have to quarantine individuals for a certain amount of time, and we'll talk to that a little bit in a second, until they will either show or not show symptoms, and then you can let them back in the workplace. So before the infected employee departs or the suspected employee departs, ask them to identify all individuals who worked in close proximity with them for a period of about 2 weeks. And we're talking about people within 6 feet, but get a good list of that, because you'll be better off in dealing with that and possibly quarantining some of those individuals rather than have them go positive on you and have the virus spread rampantly through your organization. When sending employees home, make sure you don't identify by name the infected employee or those employees that you're actually sending home due to a potential infection. Again, we have to keep in mind those laws that were in place before this thing started, such as HIPAA, are still in place today. In addition, if you work in another office, if you are a contractor and you're working on another site with other companies, make sure you inform that other building management or the other contractors of your situation. Again, not using names, but just saying, hey, we had this exposure, here's what was done about it, we wanted to let you know. The CDC provides that employees who work closely to infected workers should then self-monitor for symptoms, which the fever, cough, shortness of breath is the biggie. And when we think about how long employees should stay home if they've worked near somebody that showed symptoms or tested positive, first of all, those employees should consult with the advice of their healthcare provider, and they can do that through telehealth, or consult the public health department. It's interesting how this comes down. When there are positive cases, those fall to the local health department to investigate. So as you're coming down through this process, if you had a positive case, you're going to want to get in touch with the local health department because they're doing an active investigation on that case as they were notified by the health provider. So we also want to look and say, if we only have symptoms or if we don't get information from the health department and that employee is showing some sort of symptoms, they should remain home for at least 3 days in which they do not have a fever and they're not taking any medication relative to a fever. So they can't be taking aspirin, ibuprofen, or anything else, and they have to be fever-free for at least 3 days. And if they don't develop other symptoms. So if they don't get the tightness in the chest, the heaviness in the chest, or the cough. If the symptoms do develop, they should remain home for at least 7 days from the initial onset of symptoms and 3 days without a fever. Now, we got to remember here that we're not just talking about COVID. So if somebody develops some of the symptoms, and they may not necessarily have COVID. They may have the regular flu, they may have a cold, they may have bronchitis. So what we want to do is find out over that 7-day period whether or not they actually have COVID, or whether they should go to the hospital and be tested, or the healthcare provider and be tested, or whether it's just a normal cold and we can get by without those drastic means. So those were some important areas that people have been asking constantly about. The CDC also provides recommendations for non-healthcare businesses that have suspected or confirmed COVID-19 cases. And these are going to be in the material that you'll see on our website, so I don't want to take too much time here. But it all deals with minimizing the exposure, cleaning, how to clean and disinfect, what kind of materials to use. There's an EPA list that was released showing by product name what is effective against the COVID virus. And an interesting thing, check the expiration date on your cleaning products. I didn't know, but it turns out that chlorine has an effective date. And if you're past that date, it may not be effective against the coronavirus, and you might be cleaning for nothing. Keep in mind that you should be issuing your cleaning staff the appropriate personal protective equipment. They should be trained in that. They should be trained in how to put it on, how to take it off, and how to dispose of it. So all those things are very important. When you go through your materials, when you go through your process of cleaning and whatnot, make sure that you adhere to the OSHA Hazard Communication Standard, or if you're New York State, the right to know standard. Again, all of the OSHA laws that were in effect prior to this thing starting are still in effect now. They are being a little bit lenient on some of the enforcement and the inspections, but the rules do still pertain, and this thing will end at some time, so we want to make sure that we've adhered to all the rules. Now, one of the questions that we did get several times in the course of the past few days is, how do I know whether or not my business is in fact an essential business? And I can't give you a distinct answer because, again, it's all up to interpretation. But what I do suggest is that you get a hold of the Department of Economic Development Services guidance document for determining whether a business or enterprise is subject to workforce reduction under the recent executive orders. This was published on March 27th. We will put a link to this up on our website. But if you go through that process and you look at the different industries and different businesses that they identify as essential, what you have to think about is the fact that, okay, my business might not be considered essential except for the fact that I am in direct support of another business that is considered essential. And in that case, then your business too is going to be considered essential. So take a look at that document. It'll help you determine whether or not you're an essential business or whether a certain part of your organization, of your production process, is essential. I thank you again for listening. I'll turn it back to Allison.
Thank you, Paul. That's excellent information, very, very helpful. Now we're going to turn things over to our claims and coverage area. We have Kelly Goodsell and Adam Brown with us this afternoon, and they've been working very hard to help our clients navigate through their coverage questions, and we'll turn it over to Adam and Kelly.
Thank you, Allison. Last week we had updated you relative to coverage and also some of the conversations we've had with our insurance carriers. We don't really have an update relative to coverage today, but yesterday, the New York State Department of Financial Services did adopt an emergency regulation requiring New York State regulated insurers of life insurance and property and casualty insurance to provide relief to New York State consumers and businesses experiencing financial hardship due to COVID-19. And what this states is, and it's out there, we just received it last night, consumers experiencing financial hardship due to COVID-19 may defer paying life insurance premiums for a period of 90 days. Businesses and individuals and small businesses experiencing financial hardship due to COVID-19 may defer paying insurance premiums for property and casualty insurance for a period of 60 days. And both of those regulations also spill over into the premium finance companies, because we do have a number of customers that choose to finance their premiums through other premium finance companies. We've reached out to a number of our insurance partners on this subject between yesterday and today. The feedback we continue to receive is that special terms and conditions for payment are not automatic. There are some nuances that the carriers would like to discuss with us as far as timing of the insurance renewals. If your business is experiencing a downturn in payroll and in sales, if additional adjustments need to be made to assist you through this time. So the thing that we would ask you is just keep the communication channels open. We have had a number of calls from customers looking to make modifications midterm, and we're happy to help you through it. The other thing that we wanted to consider, if you do anticipate a shift in exposure, given what's happening, please let us know. Maybe your operations are changing. Maybe you have a location that'll be vacant for a period of time. We have had some manufacturers reach out to us just letting us know that they're going to be pivoting what they're making in order to combat product shortages in the market. We would just ask that you just reach out to us because it can shift your exposure a little bit. The conversations that we're having with the insurance carriers they are extremely flexible, and they're very much willing to assist us and you through this time. So if you do have any questions relative to coverage, potential claims, payment terms, exposures, we've been fielding a ton of questions over the last few weeks, and we encourage you just to keep reaching out, send an email, call your representatives here at One Group. It could be any member of your team, and we'll make sure to hop on it right away for you. Kelly, any updates from your end relative to the claims discussions we've been having?
Yeah, thanks, Adam. So we've been doing this now for, 3 weeks now. I think we've all been in this together. And from a claims perspective, I will say that the, questions that we're getting with respect to business interruption and civil authority and how does coverage apply, not too much has changed in that area. With respect to the Department of Financial Services, they have been ordered. You may have already received a letter from your specific property carrier outlining their position when it comes to COVID-19 and how coverage would apply. If you do get a question, if you do get that letter and you have questions regarding that, again, please reach out if you haven't already to your One Group representative. We are more than happy to go through your specific terms and conditions of your policy. Adam and I and One Group, we are actively monitoring what's going on with the different affiliations down in Washington, D.C. As soon as, we have any additional information, we'll be posting that to our website. They are developing a coalition that they will be working together with the folks who are also involved with the CARE Act on how to distribute those funds to the employers being affected, which I'm sure we'll be talking about that later on in our conversation. From a workers' compensation perspective, as you all know from our previous webinars, all of the hearing sites have been closed. Hearings are continuing to happen on a routine basis. It's business as usual when it comes to the New York State Workers' Compensation Board. Those hearings are just being done from a virtual perspective. There has been a little bit of a change. We are seeing an uptick in claims being brought to our attention for a cyber breach. So as you know, that there are bad people out there in the world, and unfortunately, when you have a health crisis such as we are currently in right now with COVID-19, we have bad people out there that will try to take advantage of breaching a cybersecurity. So with that being said, if you are affected by a cyber breach, please reach out to One Group, your representative, our claims folks specifically. If you are affected and want to know more about what you can do from a cybersecurity protection standpoint, we also have a cybersecurity expert on staff. So really, that's what we're seeing new is probably more on the cyber breach part of it from a claims perspective.
Thank you, Kelly. Now we're going to turn to HR, and I think we've had some joking internally that we could probably spend 3 hours on all of the updates that pertain to employees and HR matters. So we're not going to do that. It won't be a 3-hour, but Casey has done a great job summarizing everything. So we're going to turn it over to Casey Cohn. She will report on what's taking place on both the federal, state level, where we are today. We've also had the 2 previous webinars, so we would encourage you to look at our materials on our website from that. We figured for today we wouldn't do a full recap of everything, but really talk about where we are today and some recent developments. And certainly Casey will be answering the recent questions that have been submitted as well. And I would just like to say Casey and our HR consulting team, as well as everybody, all of our panelists have been doing a fantastic job responding to our clients, getting them answers to this very new area for us. And certainly we appreciate all the work that they are doing. So we'll turn it over to you, Casey. You might be on mute.
Hi, thank you, Allison. Good afternoon, everyone. I promise I won't take 3 hours of everyone's time. We have, as Allison mentioned in previous discussions, provided overviews of the new legislative pieces that have been put in place as a result of COVID-19. For today, I have a few updates that I wanted to share and also discuss the CARES Act specific to the unemployment changes and what that means for everyone. So since we last met and per our last conversation, there has been an update to the executive order with regards to the decrease in in-person workforce. As you may have seen, on March 27th, there was an announcement that the construction category was amended. Originally, it was listed under the essential businesses, which it still is. However, there's a much lengthier description of what that means and what that entails. But essentially, all non-essential construction must shut down except for emergency construction. For the purposes of that section in the document, construction work does not include a single worker who is the sole employee or worker on a job site. So that was a big change for folks in the construction area, and that was announced on Friday. Also announced on Sunday, the governor extended the decrease in in-person workforce for another 2 weeks and extended this through April 15th. So again, that's the 100% workforce in-person reduction for those non-essential businesses. As Paul mentioned, there is information out there, and we'll also provide information on our website as well. Additionally, moving on to the Families First Coronavirus Response Act, the FFCRA, on March 25th, the DOL, the Department of Labor, published a notice for employers to use to satisfy the posting requirement. Part of this act requires employers to post a poster, and that poster was released as promised by the DOL. The poster can be found on the Department of Labor's website, and we also sent out an update to our clients yesterday in which you can find the link to that posting. Along with the poster, the Department of Labor did provide some FAQs with regards to the act. So I think they provided some much needed guidance as far as where employers need to look and see. I think more guidance is to come, but certainly the FAQs are I think, some help to employers as we all try to navigate through this. Specifically, they did update 59 FAQs to help employers, again, kind of work through the pieces of this act. I want to talk through 5 today, so we won't go through all 59. But the first one, I think it's really important. What is the effective date of the FFCRA, which is the Emergency Paid Sick Leave, and then the extended or expanded FMLA Act? The effective date is April 1st, and that's the act is between April 1 and December 31st of 2020. I think that April 1st date is important to mention. Initially, when guidance came out, there was an April 2nd date floating around there, but it is April 1st of when these pieces go into place. Another important thing to note, what records do I need to keep when my employee takes paid sick leave or extended family and medical leave? Those that are required to provide that coverage, if an employer is intending to claim the tax credit under the FFCRA due to paying those benefits, they do need to retain appropriate documentation for the records. The IRS, the FAQ points to the IRS applicable forms and instructions. So I presume more information to come there with regards to what exactly needs to be kept, but I do think it's important to emphasize that records should be maintained by an employer if you do intend to claim a tax credit under these benefits. Another question that we have been seeing a lot is if my employer is open, but furloughs me, but furloughs an employee on or after April 1, is that employee eligible for the paid sick leave or the expanded family and medical leave? The answer is no. If your employer furloughs you because it does not have enough work or business for that employee, the employee is not entitled to take those paid sick leave benefits. Certainly in that situation, the individual may be eligible for unemployment, and they're encouraged to apply for unemployment in that scenario. Another question we've been receiving, if I'm an employer, may I require an employee to supplement or adjust the pay mandated under the FFCRA with paid leave that the employer may already have had? Employers sometimes have paid leave policies or sick time policies already in place. In this scenario, can they have the employee supplement their time? The answer is no. Under the FFCRA, only the employee may decide whether to use their existing paid time off. So whether that be vacation or personal sick time, only the employee may decide whether or not they want to use that. So the employer cannot mandate it. Another important FAQ that I wanted to mention is, do I qualify for leave for a COVID-19 related reason, even if I've already used some or all of my leave under the Family and Medical Leave Act? So if I've already used FMLA, do I qualify for this new expanded, COVID-19 related reason? The answer is twofold. If an eligible employee, they are entitled to the paid sick leave under the Emergency Paid Sick Leave Act, no matter how much FMLA has been taken. So that's up to 80 hours of paid sick time. However, if you work for a covered employer under the FMLA and you want to take the extended FMLA, which is up to the 12 weeks to care for a child whose school or daycare has been closed, this can count against FMLA entitlement. So if someone has used FMLA time, let's say earlier in the year, January of 2020, for an FMLA related event, perhaps they've used 2 weeks, that would come off of what they would be entitled to under the extended FMLA provision. So I think that's important to be aware of, as I would anticipate an increase in requests for this type of leave. Moving on from that, and again, that's a lot of information too. All of those facts are located on the Department of Labor's website, and we can provide the links to those as well. I wanted to touch briefly on the CARES Act. As many of you know, on March 25th, the Senate passed the Coronavirus Aid, Relief, and Economic Security Act, so that's what we're calling it, the CARES Act. It's known as Phase 3 of the Coronavirus Economic Relief. On March 27th, the House of Representatives passed the CARES Act, and then President Trump signed the bill into law that same day. So the CARES Act covers a lot of different pieces. The focus of my discussion today is on the unemployment piece. But essentially what it does is it opens up unemployment to help those not traditionally eligible for unemployment, including self-employed individuals, independent contractors, those with a limited work history, and those who are unable to work as a result of this coronavirus public health emergency. It provides an additional $600 per week payment to each recipient, and this is through the end of July of 2020. It also provides funding for the first week of unemployment for states to waive the traditional waiting week before the benefits begin. As we've talked before, New York and Pennsylvania have already done this, but this federal, part of the CARES Act waives that waiting week. Additionally, it provides an additional 13 weeks of unemployment. So for those where we typically think of unemployment for up to 26 weeks, this would be a total of 39 weeks of unemployment eligibility under the CARES Act. New York State has put out, I think, some really nice materials, pretty concise, that helped illustrate kind of these expanded opportunities to take unemployment in this situation, but I'll go through a few. If a member of a household has been diagnosed with COVID-19, they could be eligible for unemployment. someone that's providing care for family or household diagnosed with COVID-19 covered. Someone who quit their job as a direct result of COVID-19 could be covered. Again, as I mentioned, a self-employed individual, independent contractors, those affected by COVID-19 could be covered. I also want to point out that those that can telework with pay, generally not covered, and also those that are receiving paid sick leave or other paid leave benefits, even if they meet the criteria that I just mentioned above, those folks would not be covered. So to reiterate with unemployment, as you all know, the state determines eligibility, even with the CARES Act pieces. So it's always good to encourage those that think they may be eligible to apply. And again, the state ultimately makes the determination with regards to who is eligible. So that is it for my update today. Thank you all for listening. And I will turn it back over to Allison.
Thank you, Casey. So much information. And again, just as a reminder for everybody on the call, in case you joined after we mentioned this, but everything that everyone has spoken about is all, first of all, we're taping this webinar. And secondly, we are also posting our information that's being referenced to our website as well, because we know it's a lot to go over, but we want to make sure it's available to you as you're listening. You certainly have those reference points by visiting our website and clicking on the various links that pertain to what we've gone over so far today. At this point, we're going to turn things over to Nate Bradley. Nate works in our benefits area, and he's been working closely with our clients and our team to make sure that all of us understand the changes and make sure that we're properly communicating them to employees. So Nate, we'll turn it over to you.
Thanks, Allison. Much of what was covered in our last update relative to the CARES Act has now been passed into law. The bill expands coverage beyond what was in the Families First bill that was passed on March 18th by requiring health insurers to pay for coronavirus testing beyond those that are FDA approved, including lab and state developed tests, as well as other tests approved by Health and Human Services. Accessibility for telehealth is also expanded. High deductible health plans with HSAs may now allow pre-deductible coverage for telehealth and other remote services, as well as allowing the use of HSAs for the purchase of over-the-counter medications without having a physician's prescription. Previous guidance on telehealth allowed the ability to cover coronavirus-related services at no cost prior to the annual deductible being satisfied. Some carriers were allowing all telehealth visits to be covered at no cost. And though many did not feel that the IRS would be strict in enforcing the HSA eligibility rules in this case, we now have legal guidance that does allow this. This provision will allow for carriers and self-insured groups to offer telemedicine to do so at no cost or copay for all visit types. So allowing telemedicine at no cost for all different types of visits will help reduce traffic at the provider offices, and that is one of the goals of this measure. And also, please note that this is only a temporary relief, and this safe harbor only applies for plan years beginning before January 1 of 2022. So it'll be for the remainder of this plan year and for next plan year only at this point. In addition to allowing all telemedicine to be covered at no cost on all plans, there have also been expansions to the usage of HSAs, HRAs, and medical FSAs included in the Act. So HSAs, FSAs, and some HRAs may be used to purchase over-the-counter drugs without a physician's prescription, and this rolls back the prescription requirement imposed by the Affordable Care Act and is effective for expenses incurred and amounts paid after January 31st, 2019. So this actually is being put into effect retroactively. However, to get any of those type of things reimbursed, you would have to have a receipt still and turn it in manually, as the providers, the pharmacies where you can use like an HSA debit card, they're not set up yet to be able to use, you know, if you were to go purchase Claritin or Tylenol, something like that over the counter without a prescription. Also included in the bill is a new ability to purchase menstrual care products, including tampons, pads, liners, and similar products with an HSA, FSA, and some HRAs. So turning back to more relevant coronavirus-related portions of the CARES Act, Johnson & Johnson announced yesterday significant progress on a vaccine that could possibly be available for emergency use in early 2021. Should this vaccine or any vaccine become available, the CARES Act will require that all health plans provide free coverage without cost within 15 days of the vaccine meeting federal criteria. So that removes the usual 1 year wait on such products. So this may be the extent of the health insurance related updates, short of a phase 4 agreement, which is already being discussed. But we do continue to hear of different carrier updates, and these type of updates include covering treatments in full. Some carriers are doing that, allowing special enrollment periods for current employees. We've seen a few different carriers doing that as well, and also relaxing eligibility policies for employers that are forced to lay off or furlough employees. So with coverage and flexibility varying by carrier and by funding model, we suggest the best course of action will be to reach out to your carrier or consultant at OneGroup with any plan-specific questions. So that's it for me today, Allison. Turn it back over to you.
Okay, great. Nate, thank you so much for all the information. As we're talking about benefits, we know we've also been receiving many questions from our clients relating to retirement plans. Chuck Baracco is with us today, and he's been working closely with our clients to offer guidance, and we'll turn it over to Chuck.
All right, good afternoon. Few things I wanted to touch on, and I'm sure people have a lot of questions, and reading through this CARES Act. If you have read through the CARES Act and what it does speak to from the retirement plan side and for participants, it speaks mostly to the employee, the participant access to their account. So while that sits there today, we'll touch on those notes, but do note that we are waiting for additional guidance as far as additional provisions to allow for relaxation of contributions from an employer standpoint. There are already provisions in place that would allow you to step away from employer relationship contributions. You would want to reach out to your third-party administrator, whoever that may be, or your record keeper if it is a bundled solution. Your advisor should be able to point you in that direction as well. So just pay attention to what's going on there and what your need is currently. If you need action now and can't wait for additional guidance as far as relaxations down the road, reach out to your administrator, your record keeper, your advisor, and they should be able to walk you through some solutions today to help relax that burden. So one important thing to note on this CARES Act and how it relates to these coronavirus-related distributions is that any of these provisions are optional, right? So there is not a mandatory, this has now passed, your plan now allows it. So if you're looking at this, you may already allow hardships, you may already allow loans. You would actually have to adopt these provisions to allow these coronavirus-related distributions. We believe that having this option makes a lot more sense for you and your participants, as it does relax the ability to get that distribution back into the plan. So if it's something they need today, but it's not something that's a normal hardship where you would take that distribution, pay the penalty, taxes, applicable taxes, this is offering you the ability to waive that penalty. Well, it will waive that penalty. And then also get that money back into the plan over a 3-year period, which is significant. So it's something to help them with relief today, but allows them to get that money back into the plan. Also, if they do try to get that money back in, cannot get it back in over that 3-year window, they can actually defer the taxes on that distribution over that 3-year period. So a lot going on with this. There is obviously, we believe, value in having this option available. Keep an eye on how your record keeper is communicating that, right? So this is going to be specific to your platform that you're using, your record keeper. That is who you're going to get guidance from as to how they're going to be handling that. Hopefully this will be in some sort of communication that'll be blasted out to all of their plan sponsors, but stay in touch with your advisor, stay in touch with your administrator, whoever that may be. Just if you're looking for this now, reach out to them now, and then they can let you know. We have not seen final guidance from our platforms at this point as to how they're going to handle this. These distributions have to be taken between January 1, 2020 through 12/31/2020. So you need to act on this sooner. benefit of acting on this now and what the CARES Act is doing is it's offering you the ability to not actually restate your document to adopt this. They understand that the plan administrators, your document providers are going to be burdened significantly to update all these documents. So the actual document amendment won't be due until 2022. So you have some time to get this, and it actually can extend later than that depending on what your plan year is. So pay attention to that. Your document provider, your plan administrator will walk you through those provisions. But something that you want to look at today to get that relaxed distribution for your participants. So some of the key points here, just on that distribution that they were to take today, if they were to take these distributions, they can take a maximum of $100,000 per individual and waive that penalty. And this is aggregated across plans or across accounts. So something to pay attention to there, right? So this is not treated as an eligible rollover. So these contributions, or these distributions are not going to see the mandatory 20% withholding. Again, you have 3 years to pay the income tax back on this if you do not put the money back into the plan. So key things here, it's been coded or spoken to as a hardship provision. This is going to be slightly different than the hardships. Obviously, it has a lot more flexibility in how what the participant can do with it, how they can get the money back in. So again, coronavirus-related distributions are going to be coded slightly different than that hardship and have benefits that the participant we would believe, prefer to take versus just taking a hardship and applicable penalties with that. So along those notes, you get the 3-year period to get that money back in. For loans, they've actually increased the loan availability. So again, you would opt to have this provision. The loan limit is increased to the lesser of $100,000 or 100% of your vested account balance. And they've also waived a 1 year or delayed a 1 year period within your loan. So if the loan normally would be a 5-year loan, you now have that extra year. It's giving you a 6th year for that loan. So determining when you would actually take that loan, or if the loan's already out, kind of deferring those payments or additional payments on that loan at this point. So a lot going on here, kind of pushing this all back to your administrator, your advisor. If you have questions on how this is going to play into you, if it makes sense for you right now, we would argue that it does, at least to have that conversation to identify what's going on with your participants. If they're laid off for a period of time, but you intend on bringing them back, there's other things that you need to pay attention to from a filing standpoint that your administrator, obviously, and your record keeper will work through it with you. So pay attention to the different pieces that you're going to be receiving from your record keeper, what you need to pay attention to make sure you're adopting these provisions, and understanding which provisions you're adopting and how it's going to be communicated back to your participant. I mean, just because this is available doesn't necessarily mean these participants need to go and grab that asset. So one last point with a hardship distribution, historically, you as plan sponsor would okay or sign off on that this is a hardship. You are able to rely on that participant, that the information they're giving you, that they are affected or have been affected by this COVID-19, and therefore that the distribution would qualify. So something that the burden doesn't fall on you. You can offer this, allow them the flexibility to get it, and then it will rely on their reporting, obviously correctly, that they're taking this for the proper purposes. More to come, I believe, if they're going to push forward. There's looking to, again, relax the requirements for those employers and the employer contributions that you would be making for the year. Again, to the point I made earlier, those provisions or those abilities are already there. It just has timelines for communication to the participant. They're looking to relax those timelines. But if this is something you can't wait for, pick up the phone, call your administrator, call your advisor, and they should be able to walk you through that. And If you don't know who to call, you can always reach out to us. We're happy to address whatever concerns you may have based on the record keeper you're working with. More than likely, we have a plan that's there. So we can tell you what we've seen from them and what guidance that we've been provided at that point. Happy to help. Allison, back to you.
Thank you. Thank you, Chuck, very much. Great updates again. Our last panelist, our last expert we have today is Todd Hoffman. Todd will be talking for the next 10 or so minutes about some of the results that will help, the results of the CARES Act that will be helpful to our clients relating to small business relief. So a lot of information out there. I think you've heard us all say that over and over again because there is so much information. But Todd's going to take us through some of the highlights and we'll turn it over to him. And Todd, you might be on mute. Todd Hoffman, if you want to, I think you might be on mute. I think we might be having a technical issue. So let me just check with Todd and see if his phone is on mute. He can unmute. All right. Well, we're not able to unmute Todd. So
Allison, can you hear me?
Hi, Todd. Perfect. There you are. Go ahead.
Well, that started out perfectly. All right, everybody still here? We're on the final stretch, so grab a cup of coffee and I'll take you through this. I'm going to be talking about the financing relief portion of the CARES Act with a specific focus on the small business. And before I get started, I want to talk about two resources which I found incredibly helpful, which I would direct you to. Both of these should be up on our website soon, but you can also access them yourself. The first one is through the U.S. Chamber of Commerce. It's the Coronavirus Emergency Loan Small Business Guide and Checklist. Again, that's the U.S. Chamber. And then locally, MACNY CARES Act Q&A on key provisions. That's another great resource to look at. So I recommend you take a look at this. Okay, so how does the new CARES Act help small business? Basically, it creates a new loan program that's run out of the Small Business Administration, or the SBA. That program is called the Paycheck Protection Program, PPP. There's been a lot of confusion about the names and everything, but the PPP is part of the 7A program run by the Small Business Administration. Essentially, that program is designed to provide business capital to continue paying to businesses so they can pay their workers during the COVID-19 crisis. To get financing, you're going to be working through your private local banks or lending institutions, such as credit unions. Most in those banks have to be approved by the SBA to participate in the program. Most local banks are already approved to participate. I can't think of anybody offhand who wouldn't be part of it unless they're a very small credit union. So most of the commercial banks that you know in town are participants in the SBA program. That also answers one of the seminar questions we got, which is, do you have an update on eligible lenders in the market? You should be in good shape. If you can't find one or you're having an issue, just let us know and we'll get you in touch with somebody who's part of the program. Before I jump into the details of the program, I just wanted to comment on where things are with the banks. I've talked to quite a few local banks in the last day. Like everyone else, they're in the midst of sorting this all out. They're reviewing the program. They're figuring out how to implement it internally at each of their institutions. There's a lot of questions going back and forth with the SBA on details. So one thing I was saying is that they're getting inundated with calls. So patience, like anything else these days, like everything else these days, patience will be required. The bottom line is they don't have all the answers yet. So just please remember that when you talk to them. They're still, it's a working process and they're still working on it, but they are working on it and working on it hard.
The best advice I can give you before I talk about the program is to reach out to your bank with whom you currently do business. Their first priority is going to be to their existing clients. So open up your lines of communication. Now is not the time to be changing banks if you can avoid it. Obviously, it's preferable to working with someone that knows you and knows your business. So get that line of communication going early if you can. So the PPP program, who's eligible for this program? Small businesses with fewer than 500 employees, including full-time, part-time, or any other status. That includes 501c3s, nonprofits, veterans organizations, tribal businesses, sole proprietorships, independent contractors, and self-employed individuals. So pretty much covers the gamut. What are lenders, what are the banks going to be asking for, or what are they going to need from you? First question they're going to say is, was your business operating and paying salaries, payroll taxes before February 15th, 2020? You'll also have to certify to them, apparently in writing, that there's the uncertainty of current economic conditions makes a loan request necessary to support your ongoing operations, that you will use the loan proceeds to retain workers and maintain payroll or make mortgage, lease, and utility payments, that you don't have another application process for the same purpose, and you've got to apply for the loan before June 30th, 2020. Normally, a bank, when you're applying for one of these loans, would ask you do a full analysis of your historical financial information. They'd ask for 3 years financial statements, business, possibly personal tax returns. I'm not sure if that's going to be required in this case. They may be streamlining this program to such an extent that they're eliminating all that. However, be ready, be prepared with that information in case it is needed. I do believe that you're going to need payroll information too at some point, and we'll touch on that in just a minute. One of the things the bank's not going to require is a personal guarantee, collateral, no fees, and there's going to be 100% guarantee versus the typical 75 to 80%. So how much can you borrow? You can borrow up to 2.5 times your average monthly payroll cost based on the prior year, not to exceed $10 million. So in order to calculate that, I'm going to refer you to that U.S. Chamber of Commerce brochure that I just mentioned. It's a great resource that tells you exactly how to, what numbers go into that. Some numbers are included, some numbers are excluded, but it gives you a great overview on how to calculate that. It also includes information for seasonal businesses and for businesses with employees earning tips. So what can you use the loan for, the business loan for? They've got to be used, the money's got to be used to pay employee compensation and benefits, including salaries, healthcare costs, retirement benefits, vacation, etc. Anything falling into that category. It can also be used to pay rent, mortgage payments, lease payments, utility bills. However, I'm going to, give say that you need to double check with your bank on this. They're again going to be the arbiter of all this, so make sure you double check on that information. As far as repayment goes, for loans obtained between February 15th, 2020 to June 30, 2020, the lender, in this case, will allow a complete deferment of repayment of at least 6 months and possibly up to 1 year. So you're not going to have to make any payments on this for 6 months and possibly a year. The other piece, the big piece of this, is loan forgiveness. Are borrowers eligible for loan forgiveness? They are, up to an amount which is equal to certain costs incurred and payments made during an 8-week period starting from the date that you get the loan for the following 8 weeks. So that's important to think about. It's an 8-week period. Eligible costs include, again, those payroll costs that we talked about, mortgage, interest, rent, utility payments. And again, I'm going to refer you to the material that I talked about. The other important people to talk to in this whole thing are your CPAs. There's a lot of CPAs in town right now that are offering webinars like this, and they're also offering their services to folks who just have questions. So don't hesitate to reach out either to your CPA, or if you need a CPA, we can give you some names to talk to. Can the loan forgiveness be reduced? So in other words, is there a possibility, you would not be able to have the loan waived? Yeah, the whole idea of this program is that you're going to keep your payroll costs up, that you're going to keep people employed. So if there's a reduction in the number of your employees, or if there's a reduction of greater than 25% in the wages paid to your employees, then that could reduce the amount that you can get forgiven. So again, another question for your CPA and your bank. I believe that they're going to look at that, and there's two options going back to a period of time, either last year or this year, where they make a comparison as to that 25% reduction. So again, you can bring folks back later in order to offset those costs. All right, lost my train of thought there. Lastly, there's a couple questions that somebody put out in the webinar, which I'm just going to deal with one question. It's an example. Small bookstore or business located is closed. If the owner takes an SBA loan, can he pay his employees and have a portion of that loan forgiven? Well, the answer, based on what we've seen here, is yes, subject to the limitations that we talked about and subject to the forgiveness rules. The other piece is, what can he do about paying his rent, utilities? That's part of the issue, or part of the allowed expenses, or rent, utilities, and making money for himself to live on. I read that and said that probably counts as salary, and it's probably can be used as part of the program. So I hope that answers that question. If not, please reach out to us, and we'll help you expand on that a little bit. Again, I'm just going to remind everybody, because I'm out of time, to reach out to your local bank and your CPA for direction and information. There's additional information on this program. Again, I would recommend the WACI website on businesses that have more than 500 employees. There's funding available for them, but it's a different program and has different rules. So reach out again to CPA and/or the Chamber and MACNY for information on that. Allison, I'll take it back to you.
Thank you, Todd. And we did go a little bit over by 1 minute, so we'll wrap up real quickly. Thank you so much to all of our panelists, our experts today. Great job. And thank you for all of you who joined us. We will be holding additional informational sessions in the future. We will be posting information, as we have been, to our website at onegroup.com. And certainly, if there's anything that we didn't address or answer for you today, please feel free to reach out to your One Group contact with any additional questions. We continue to be here for you during this challenging time, and we thank you very much for your time this afternoon. Thank you.